Thank you for the introduction. And first of all, yes, I am quite fatigued, so it's quite appropriate that I'm speaking on this topic. And secondly, I apologise to the translators. Not only am I speaking in English, but I'm speaking in Australian English, so it could be quite difficult. So, is it possible to see the slides on the front here? Is it okay? Yep, perfect. Thank you. So what I hope to talk to you about today in the next 30 minutes is a definition of fatigue. The brief I've been given to talk about is quite difficult because the definition of fatigue is there's no consensus. It's very complicated. But to help us better understand fatigue, I'll talk about the genesis of fatigue, or where our fatigue manifests. And then I'll talk about the acute fatigue, the chronic fatigue, and then finally, I'll briefly talk about methods that we can use to reduce fatigue. So for the definition, athlete fatigue is both psychological and biological. And it's really associated with an inability to complete a task that an athlete could previously do in a recent time frame. So something you could do recently, and if you can't do it now, and you have altered perceptions of effort, so it feels harder, and it's also associated with feeling fatigued or tired. So that's a classic definition of athlete fatigue. It's long and it's complicated. Essentially, fatigue manifests or begins centrally and also appears peripherally. But ultimately, all it results in is reduced performance. So what limits our performance? If we think mainly about endurance exercise, you can see on the left-hand side of the screen a muscle contracting. And what we have there is the nerve impulses from the brain getting to the muscle, that electrical signal then releasing chemicals into the muscle across the synaptic cleft, and then releasing calcium onto the troponin complex that allows actin and myosin to contract. Now that's one part of producing force. It's the second part is having energy available to allow the contraction to take place. And to have that, we need fuel supply, and we also need to have blood supply. So there's many things that can go wrong into getting the result of producing force. And some of those things that can cause that contraction to not work as effectively as acidosis, so after intense exercise, so like the blood lactate accumulating and the acidosis associated with that. We can have insufficient fuel, like carbohydrate or glycogen not being available. Also, we're not trained enough to deliver enough blood or oxygen to the working muscle. Or also we can overheat and our core temperature rises. And that core temperature affects our brain and it decides that it won't send out the signals like it once would before, and we contract less. So as you can see, it's quite complex. So there's central origins of fatigue, and that occurs to do with the brain and the spinal cord. And there's peripheral origins of fatigue, and that's to do with things within the muscle, the fuel availability, the supply of energy, the apparatus or the architecture that contracts the actin and myosin. And all those together form the foundation of fatigue in sport. Just to complicate it further, there's acute fatigue and there's chronic fatigue. Some of the causes of acute fatigue are shown on the slides. Things such as I mentioned already, acidosis or pH dropping, low availability of fuel, increase in serotonin in the brain, overheating, or even things such as decreased motivation will relate to increased acute fatigue. Over the longer term, the fatigue that occurs with intensive training programs, during intensified training periods, or periods of overtraining, there's other causes of fatigue. Damage to the muscle fibers, changes in hormonal regulation, inadequate diet, immune suppression, and all of these factors are related to fatigue. So there's a lot we have to understand, and there's a lot we need to control as coaches. Now, depending on your sport, different types of fatigue will affect performance. So we have neuromuscular fatigue, or the fatigue to do with the nerves and the muscles. And the two main causes of neuromuscular fatigue is the inability of the messages to transmit down the nerves, or the inability of the muscle fibers to contract. There's also metabolic fatigue, and essentially that is to do with an inadequate fuel supply. So an unavailability of carbohydrate is the main source, or alternatively, an acute accumulation of metabolites in the muscle that stop it contracting and producing force. And what we have here is a schematic of how the muscle contracts. And on the top of the muscle, we get a nerve impulse. It causes a sarcoplasmic reticulum, or outside the nerve fiber, to release calcium into the muscle. And that calcium is raining down into this actin and myosin complex here. And you can see the ball coming from the top of the slide, the yellow ball. It appears every second or so. And if that can't attach to the troponin complex, or if it stops being supplied, muscle does not contract. And simple things as acidosis will prevent that from occurring. And then we have mental fatigue, and less is known about mental fatigue, but for coaches, this is probably the most concerning. It's difficult to control. And we've recently done quite a number of studies trying to unpack or understand the influence of mental fatigue on sport performance. Mental fatigue is really caused not by physical activity itself, but more by cognitively demanding exercises or activities. Playing on the PlayStation, on the iPhone, concentrating intensely, a hard day at work, a hard day at study. And that creates a high psychological load. And so we need to get our athletes to keep off their iPhones, because that can definitely cause mental fatigue. And that causes the tiredness and fatigue. That this can occur both acutely and also chronically. This also occurs, I'd admit I'd probably have quite a bit of mental fatigue at the moment. It's associated with things such as travel fatigue or jet lag. Now, we've recently done several studies looking at mental fatigue, where we induce fatigue in the brain in the absence of any physical fatigue. And we've found in football players, at least, as our subjects, that their physical performance is reduced. So without doing anything to the muscle, anything to the body, except for training or stimulating the brain from doing computer tasks, our footballers ran less than they did without the task. We also found that their technical skills, their ability to pass the ball accurately, shoot the ball with speed, was reduced. And we also have found that their ability to maintain position in small-sided games is reduced. So it affects physical performance, tactical performance, and technical performance. And finally, we've also done a recent study that demonstrated it affects their ability to make decisions quickly, the correct decision quickly. So differently to the earlier sources of fatigue, mental fatigue, we're starting to, which is directly related to training, this is related to non-training stressors. And that can also influence our physical performance and sporting performance. Now, one source of fatigue I didn't talk about, but I assume that you're well aware, is the impact of dehydration, of decreased fluid intake, and the impact of fluid loss on our cell function and our cognitive function. So what I've done up here is created a table. It shows as the main sources of fatigue in dehydration, metabolic fatigue, neuromuscular fatigue, and mental fatigue. And then I've identified the common sources of fatigue in different sports, whether they be endurance, team sports, explosive sports, or precision sports. And what we can see that there's different sources of fatigue for these different events. So for your endurance sports, clearly dehydration or team sports is a main problem. Similarly, metabolic fatigue, so the things that happen in the muscle, as I mentioned earlier, is also a greater priority for endurance and team sports. Whereas neuromuscular fatigue may be of greater interest to those working in strength power sports and team sports compared to precision sports. Mental fatigue is a cause of concern for coaches in all sports, but probably has the greatest impact in precision sports, where high levels of concentration are required and really fine performances or control of movement is also demanded. However, whilst we haven't really investigated the long-term impact of mental fatigue on these other sports, I'd expect that they'll have a lower but also an important impact on performance in all sports. So fatigue ultimately results in decreased work or performance in athletes. It involves the brain and it involves the muscles. But it's much more than physiology. As coaches know, psychology is really important. And I think psychology has a really strong role to play in the performance that occurs in terms of athletic performance. And really what it is the balance between how motivated an athlete is to give the effort that they require. And our role as coaches is to motivate our athletes. And also our role in physical training is to develop the physical qualities where they can move at a faster pace with a lower perceived exertion. So through training, we increase our resistance to fatigue, and with our coaching, we increase our motivation. And the balance between those ultimately results in our work capacity. Now, if we have an athlete that has low motivation and a big effort required, generally their performance is reduced. Our job as coaches is obviously to improve their motivation and do the training program in that the effort required to do a task is reduced. So what do we do before performance to improve? Before performances or events or competition, we optimise our physiological state through training. We optimise our psychological state. Our training experiences feed into this. But also what affects athlete performance is the importance of the activity. We find in our laboratory studies, even though we're motivating athletes heavily, if we've tested them a lot, their motivation to perform is reduced. So they tend to reserve their best performances for performances that they perceive to be important. So they're things we can do before exercise. After exercise, during exercise, things we can do is improve the availability of energy, fueling, drinking. We can control the rate of heat production through cooling mechanisms or cooling strategies. And obviously drinking. They're common things. There's many other things during exercise that we can do, the things that we need to get right to make sure our athletic performance is not impacted negatively by fatigue. And I really think it's not fatigue itself that always manifests in poor performance. It's the inability to be motivated to give the effort that may result in fatigue. It's a much more complicated model than just considering the muscle itself. So that's more about acute fatigue and muscle fatigue. What about chronic training fatigue? And in high performance athletes or athletes who train a lot, this is a problem. Now, you'd all have probably seen this slide before or something similar. If we do a training bout, we immediately feel a fatigue response. So if we go and train now, immediately we feel fatigue. We can perceive it. And we gain a fatigue response from a training session. However, we also gain a fitness response from that same session. But we don't necessarily perceive the fitness response. We don't feel fitter immediately. That's because the rate of rise of fatigue is much faster than that of fitness, But fortunately for performance, the decay of fatigue response from a training session is also faster. And so what we get is we tend to get an adaptation curve, it didn't show, where we get a supercompensation response where the performance returns after a short period after exercise. Now, we show on this slide here, down the bottom, the black boxes show training sessions. And we've got a period of dense training followed by a period of less dense training. Something like we might do leading into a competition. Now, according to the previous slide, if we add the fatigue and the fitness responses from each training session, or accumulate that over time, we can see following intense training that fatigue levels are quite high. We can also see that the fitness levels are also quite high. But the performance levels at this stage won't be great because the fatigue is masking the fitness response. However, with a taper period or a shorter period of less training, the fatigue dissipates or goes away and the fitness remains. And using the formula of our performance equals fitness minus fatigue, we'll get an adaptation curve, in theory, that looks something like on the slide. And this is the fundamental basis of training theory, of periodization. And as coaches, you're innately aware of this. However, it doesn't always work out nicely as it does on this slide. It's a lot more complicated. But using this simple formula of performance equals fitness minus fatigue, we can use this to monitor and control our training to ensure that chronic fatigue doesn't occur in our athletes. So, the fatigue side of this formula, fatigue can occur in a number of ways. We know already it can appear as neuromuscular fatigue. It can also appear as metabolic fatigue, and it also can appear as psychological fatigue. And this results in an imbalance between training load and recovery. So to get this balance right, we need to control our training load. And this ultimately results, if we control this well, in optimizing our physical performance. However, most sports aren't purely reliant upon physical performance. Sports performance, which is more than just physical performance, also relies on other factors such as luck, motivation, tactics, cohesion, skills, technical ability, tactical ability. And as coaches, you're well aware of this. But if we get the basis of training right, I think we can minimize the likelihood of chronic fatigue occurring in our athletes. So to take full advantage of this formula, all we need to do is to be able to measure our training, to quantify our training. And that will allow us to understand the stimulus that we're providing to our athletes and then hopefully minimize fatigue during periods where fatigue is not wanted. As coaches, you're aware, though, there's also periods where fatigue is planned and fatigue is necessary. And that fatigue is what builds our athletes to adapt and to cope in the periods of difficulty in intense competition. Okay, so training load's important in controlling fatigue. What I've got here is a slide that shows on the x-axis the load from low to high, and on the y-axis we've got the outcome response from low to high. The first line here shows the relationship between training load and physical performance. There appears to be a linear response until there's a break point where performance is reduced with increased load, and that's due to chronic fatigue or the accumulation of too much fatigue. We have a similar relationship with performance at fitness outcomes, but injury and illness has a different relationship, where at low load, our likelihoods of injury and illness are high, and at very high loads, our likelihood of injury and illness are very high or higher. So we don't really want as coaches to be down this side of the graph. We don't want to have low performance, low fitness, and low injury. We really want to be somewhere in this green zone, and we kind of want to avoid the red zone. But if I asked all of you whereabouts on this figure would you want to be, you would want to be just on the inside of the red line in the green zone, right, the closest you could get to the red zone without being in the red zone. And most coaches would respond in this way. So we want to push our athletes to maximise our physical capacities without increasing our risk of illness, injury, or fatigue. And as we move with a continued intensive training, we get an increased state of fatigue, and this gives us an increased severity of symptoms that appear. And as coaches, you become aware of these symptoms. A single training session you usually cope okay with. But as we move into overreaching, where we have a decrease in performance probably planned, and then in severe cases along this fatigue continuum, we could lead to overtraining syndrome, which is very uncommon in athletes, but it does occur where your performance will remain reduced for long periods of time, even in the presence of having recovery activities. So, depending on how we plan our training, we can move somewhere along this fatigue continuum. And we really want to be aware of moving too far to the right side of this zone. So there's different stages of fatigue. We have acute fatigue, which usually manifests or appears 24 to 36 hours after a training session. And we feel it. A different type of fatigue is what we call functional overreaching, where we deliberately train hard during an intensified period of training, say several weeks or a month, a hard training block. And what happens there is we perceive high fatigue, but our performance is reduced. But this is planned. And this is called functional because if we provide some rest after this period, we'll taper, we'll supercompensate, and performance should rebound to beyond its previous capacity. Then we lead to non-functional overreaching. So functional is probably on the green side of that line on the previous slide. Non-functional starts to be in the red zone, where we push hard, we get fatigued, but with recovery, we don't respond. It could take weeks or months to respond. So that's not necessarily where we want our athletes to be. And finally, we have overtraining syndrome, where this can be career-ending for some athletes, where we push them too hard for too long, they don't self-regulate. These are usually highly motivated athletes, commonly in endurance sports, ultra-endurance sports, and this can relate to dysfunction of the bodily systems and relate to chronic fatigue syndrome or similar appearing, and this can be career-ending. We definitely want to avoid this. Unfortunately, my PhD many years ago was on overtraining or overreaching, and I tried to look for magic markers to see if we could find idiosyncratic or single markers of are we doing too much, are we overreaching, are we overtraining? And unfortunately, myself and many others have come to the similar conclusion that the only way to diagnose overtraining is through decreased performance. There's no single blood measure, there's no single psychological measure that appears that it tells us if we're doing too much. You need to look at the athlete as a whole to determine that. Now, overtraining or doing overtraining or becoming overreached occurs at different proportions in different athletes, but fundamentally, most athletes, or the serious athletes, will experience these symptoms over time. Some sports, usually the longer endurance sports, experience these symptoms than, say, the speed, power, or the precision sports. But we need to be aware of the symptoms that occur that we can see as coaches to be aware if our athlete is becoming too fatigued. The biggest one and the most obvious one is that we've got reduced performance and a high perception of fatigue. So they feel fatigued. They tell you, coach, I'm fatigued. We can do some clinical studies or some laboratory studies and we can get lower heart rate with an elevated perception of effort. So the heart rate is lower, which normally tells us that they're getting fitter. But if your heart rate's lower and they're perceiving more fatigue, this is a really good early warning sign of overreaching. Poorer cognitive performance or poorer decision making at higher intensities is another good symptom. We can do blood lactate measures, and some of these reduced blood lactate responses during a standard lab test can tell us. Athletes who are regularly getting ill or sick or having disturbed sleep and poor sleep are also typical symptoms of athletes that are doing too much. And the most common one is disturbed mood. Moody, cranky, unhappy athletes is a really good symptom or sign that perhaps we need to look at the training program. So what we do to reduce this is implement a simple athlete monitoring system to allow us to prevent this fatigue from occurring. And without going in too much detail, it's probably another hour of speaking to explain in fine detail. Simply, we measure the training process. From doing the training plan, we measure the training dose, so how much training they do, which is relatively easy now with micro-technology that occurs. In team sports, we can measure it with GPS. In endurance sports, there's a myriad of Garmin, TomTom, different types of watches that we can use to measure what we did. So we measure what they do, then we also measure how they respond. And we look at this regularly for every session. And in terms of the response, we simply ask them, using session RP, how hard their session was. And we also ask them how they feel on a daily basis or semi-regularly basis, using short questionnaires. And this is based on the earlier equation of the performance equals the fitness minus fatigue. If we measure the dose, we can measure the fatigue response. We use through heart rate measures, we measure the fitness response, and integrating these measures together, we get some regular feedback on how our athletes are coping, and this can give us good insight into planning the following training session. So simple athlete monitoring is not expensive. It's easy to do. All it takes is a good spreadsheet and some good dedication in working with the athletes. Simply the session RPE. If you have some technology, maybe you can measure the load using microtechnology. That's the training load. We can measure the perception of fatigue using short questionnaires. We can measure the heart rate response to see if they're not coping at reasonably regular intervals, every 2 or so months. And for those who aren't responding, I suppose then we refer them to doctors. If we've got those who present with fatigue and high symptoms, they are definitely for medical follow-up. But doing this simple monitoring on a daily basis can help us prevent our athletes from moving from functional overreaching into non-responding, into non-functional overreaching or overtraining. So simple session RPE, for those of you who may not be aware, is very simple. After each workout, we use a simple scale and we ask them, how hard was the training session? And they will look at the description and give a number relevant to how intense their training session was. And that number is a measure of intensity. And to get the measure of load, we just times that by the duration. So for example, if we went for a run for 40 minutes and we perceived that was hard, we'd give on the chart an RPE of 5. That would be a hard session. Multiply that by the duration of 40 minutes, and that's a load of 200 units. And doing this regularly, we can then see the time course of dose we're giving our athletes, and that can help us understand the training we're giving and also give us great context to interpreting how our athletes are responding to training. Now, it's really important we do something as simple as this. Here's a relationship using this measure. On the x-axis is training load, the y-axis is illness or complaints. And you can see the relationship here of increasing training loads and increased illness. By measuring this within individuals, it can help us understand tolerance levels to training loads and give us good indication in planning future training. Because as coaches, we always want to give, or we tend to want to give, a high volume of training. Unfortunately, in the high training volume, a high training load that we know we must do to perform our best, it also gives us our increased risk of injury and illness. And by using a monitoring system, it perhaps can stop us from becoming too fatigued and resulting in some of these symptoms that are counterproductive to producing optimal performance. So, to summarise, the treatment of the chronic fatigue is really planning and controlling our training, periodisation of the training load, matching energy intake, so knowing when we're training hard, when we can increase our energy intake, or when we're training low, with lower training load, not having such a high intake. We can also plan to match our recovery activities around these periods. We can also teach our athletes to listen to their bodies, and fundamentally, the fundamental simple rule is avoiding doing too much training too quickly or changing intensity and volume concurrently together. That will really increase the risk of this chronic fatigue occurring in our training, in our athletes. So to summarise, I started off with something quite complex. Fatigue is very complex. It's psychological and it's biological. And its development depends on the athlete, the sport and the activity they're undertaking. It also depends on the environment you're training in and the type of training that we're prescribing. Now, we understand as coaches that fatigue is an essential and necessary and a very productive part of a training program. It's essential for adaptation. But we also need to understand too much fatigue or too much fatigue without recovery can be harmful. Therefore, we need recovery treatments, and they can be individualised to your athlete, your sport, and your training. And I'll discuss that in my next presentation. So, careful planning of recovery, it needs to match to the fatigue, and that will help us achieve our best performances. So hopefully I've achieved in 30 minutes as my brief to give us an overview of an attempt at defining fatigue. I don't think I've defined it well. It's very unclear, but it's very complicated. Hopefully I've unpacked some of those complications for you, and you have at least a better understanding of fatigue in your athletes. Thank you.